This is Dr. Daniel Paul, orthopedic doc with Easy Orthopedics, and today we're going to talk about how you would know if a back injury is serious. We put out new content weekly, so please like and subscribe. So, back injury, if it's serious, everyone's thrown out their back or lifted something they shouldn't, and maybe it's very painful. Any sort of back pain is usually very painful. It's serious when you have pain that goes from your back and it travels down your legs, or it travels into the front of your thighs. That can indicate that you have a herniated disc in your back and it's not just muscular. If it's a really big herniated disc and it's really pressing on the spinal canal, you can get something called cauda equina syndrome, which is where you'll lose your bowel bladder and you'll have numbness on the inside of your thighs. They call it saddle anesthesia, like if you were to sit on a saddle. That's how they termed it. That is probably the most urgent thing that you can get with low back pain. That requires decompression within 48 hours. But apart from that, it's pretty rare. Most people have just a strain, and that'll go away on its own with time and exercise and therapy and stuff. The real serious things where most people are probably while you're watching this video is if it's a herniated disc. Now, a lot of people have herniated discs in their back. Most of them are asymptomatic. The older you get, the more often you're likely to find discs and herniations and arthritis. And really nobody has a normal MRI of their spine if they're over 20 years old. But if there's a big herniated disc, you can see that on MRI, and you can see that it's actually pushing on the nerve, and that'll cause pain. That's what causes the pain shooting down the back of your leg, or shooting like into your thigh, the front of your thigh. A lot of times that'll go away on its own too, but I would say that's a more serious injury. When it doesn't, then you end up getting something called a microdiscectomy, where they take the disc out, and that usually gets rid of the leg pain. Now, it's not going to get rid of the back pain; it's just going to get rid of the leg pain. If there's more involved, then you'll end up with fusions or whatnot. Sometimes you can have a normal, good old back strain that's just muscular, and you ends up tightening up your butt muscles, and it tightens up a muscle called the piriformis, which can cause pain going down the back of your leg too. But honestly, to answer the question of this video, if there's no pain traveling down your legs, it's probably not a serious issue. It's most likely muscular. If it is starting to travel down, that's when I say it's more along the lines of serious. If you get to the point where you're losing your bowel and bladder and you have numbness in your thighs, then that's like a surgical urgency. So you got to get that done right away. That's something you go to the ER for. So I hope I was able to answer your questions about when a back injury is serious. If you have any questions I didn't answer, feel free to leave them in the comments below, and I'll do my best to respond. But I can't give you any specific medical advice because this video and all my videos are for educational purposes only. Thanks for watching.